Good afternoon, everyone. Thanks for joining us on the media briefing for today. We are still waiting for a few more people on the briefing, but we're going to go ahead and get started. We're hoping Cal Fire can join us, but since we've got Dr. Moreno on the line, we'll go ahead and get started with him. If there are any questions for Dr. Moreno, go ahead and put them in the chat. I see one. Dr. Moreno, are you ready for questions?
Good afternoon. Sorry, it took me a while to get this started. Yeah, I can take questions on COVID.
Great, thanks very much. And thanks for being flexible for our start today. So I've got a question for you. First question, COVID-19 doesn't appear to be going away anytime soon. Has the Monterey County Health Department developed a long-term plan to contend with this disease? And if not, has it considered doing so?
Hey, man. So Monterey County, like the rest of the California and the nation, are still in a pandemic. And so we continue to implement strategies that are known to reduce the spread of COVID-19. So I think it's still very important for people to get vaccinated. It's the most important and effective strategy we have. So that's one of the strategies that we certainly have planned for and continue to promote community-wide. Also wearing face covering, that's another important strategy, especially if you're in indoor public spaces. And of course, one still very important strategy that we have continued to promote is to have people stay home when they're sick. And it's not just for COVID, it's for COVID as well as influenza and other contagious viruses.
Thanks very much. Another question for you. What percentage of cases in Monterey County are due to the Omicron strain? Do you still think about 80%?
For the month of December, I think we were around 80%. I don't think we're quite at 100% this time, but our laboratory continues to perform whole genome sequencing, and other laboratories are also performing whole genome sequencing on specimens that are collected from residents here in Monterey County.
Right, thank you. Next question. There is a COVID outbreak at Victory Mission in Salinas' Chinatown. The shelter is in lockdown. Is the health department aware of that? And is the department doing anything to mitigate this outbreak?
So, we generally don't share publicly information about increased cases or outbreaks among agencies and organizations. That's a practice we've had for a long time. Any organization that thinks that they're experiencing an outbreak is encouraged to contact us and let us know, and we can do what is necessary to assist that organization in following guidance, following Cal OSHA requirements, and taking reasonable measures to slow the spread of COVID or any other infectious disease that can cause outbreaks in organizations and agencies here in Monterey County.
Right, thank you for that. Next question, Dr. Moreno, have you been infected with COVID-19?
I'm here to answer questions about COVID related to the community.
All right. Next question, when do you think the case rate will level off in Monterey County?
Really can't say. All I can say is based on prior experience with previous surges we've seen here in Monterey County, the surges have lasted anywhere from about 3 to 4 months at a time. So that's what we know in the past. But I can't predict how long this surge is going to last. We'll continue to monitor the case rate and share that publicly on our website. At this point, the data doesn't yet show that we're leveling off or that we've reached the peak, although it does appear that there's signs that in California statewide, the surge is starting to level off, and also there's maybe signs in the region that case rates starting to level off, which is a good sign. Monterey County in the past has also followed the region and the state by about 2 weeks. So we've learned that from prior surges. So We may still have a little ways to go before we start reaching our peak, leveling off, and having a decrease in cases.
Okay, thank you for that. Next question. Dr. Moreno, is the health department having a staffing shortage due to COVID?
That I think we can, if you want to pass that question on to me, I can pass it on to human resources.
Right. Next question, and this is a follow-up question to the earlier outbreak question. Wouldn't it be in the public's benefit or best interest to know if a particular organization, public or private, is experiencing an outbreak?
The public health responsibility is to take action as necessary to protect public health while still protecting the privacy of individuals involved in potential outbreaks or individual cases. So if we believe that there is an outbreak poses a threat to individuals outside of those involved with an outbreak, then we would communicate, but only at the level necessary to inform and further protect people related to the outbreak. So if that's not the case, then we generally don't share information with the public, because the public generally we don't believe it's impacted by the potential outbreak.
All right, thank you. I don't have any other questions I'm seeing right now in chat. Are there any other questions for Dr. Moreno before he leaves? Seeing none. Thank you very much, Dr. Moreno, for joining us and answering some questions.
Sure.
And so we're very pleased now to have our CAL FIRE representative on the briefing, Cecilia Juliet. She's the PIO for CAL FIRE, and she's going to give us some information from the Colorado fire. Good afternoon, Cecile.
Hi, thank you so much for having me on, and I'm very excited to announce some good news that I know everybody's been waiting for several days now. The highway is now open and the evacuation orders have been lifted as of noon today. So I know that's something a lot of people have been waiting for. So we're very glad to be able to deliver that news today.
And your video is sideways, just so you know.
Oh, well, that's a problem.
So there you go.
How's that? Is that better?
That is much better. Not that you don't look fine either way. But so I'm going to, for people who are recording this, can you give that information again?
Yes, we are very happy to report that as of noon today, we were able to lift all of the evacuation orders and all of the road closures have been lifted.
So for people who, and so explain now, what is the next step for people?
For us, the next step, and for all of our partnering agencies, is just to continue strengthening the control lines, getting a handle on the fire, and just making sure that all the infrastructure is in place. I don't want to speak for the other agencies, but I know that there is a lot of infrastructure that still needs to be repaired.
So let me ask you another question. People are able to go back in, but we still are at 55% containment today. What do you want the public to know? If the highway is open, the roadway is open, people are going to be traveling through, what should they know about the fire situation down there?
One thing that everybody really needs to be cognizant of is that there are going to be a lot of emergency vehicles on the road. That's a very narrow stretch of road. It's windy. It can be treacherous. So there's going to be fire trucks. There's going to be other big utility vehicles. PG&E is still replacing several poles, and there's also going to be intermittent traffic controls. So it's not going to be completely open with no issues whatsoever for the next foreseeable future. Everybody just driving through the area, just please go slowly so that we don't have any issues.
And in terms of information about the fire, is CAL FIRE going to be continuing its information morning and night as far as fire activities?
Yes, we will continue with the information outflow until the fire is contained.
Great. And thanks very much. And thanks for just running, I'm sure, like crazy to drop in even sideways to the briefing. For any of our media partners, are there any questions for Cecile while we've got her? Go ahead and put them in chat. Okay, so I do have a question for you, Cecile. CAL FIRE, is there any new information on the cause of the fire that was released yesterday?
No, that is still an ongoing investigation, and there won't be any new information until the investigation has been completed.
Thank you. Any other questions for Cecile while we've got her here? I am seeing none. Okay, I've got a yes, so I'm going to hold on for a question. Cecile, maybe you can talk about oh, well, I was going to ask you the same thing. So what are we doing with staffing? With the highway opening and the improvement, is that a demobilization for the fire?
Well, some people are being demobilized, but this is something that is a constant, it's on a constant discussion. And yes, we are demobilizing some equipment, but we still have enough resources. So, we want to have the right amount of resources, but we don't want to overdo it. Everything costs money. So it's a balancing act. And so, yes, some resources are being released, but we are definitely keeping the crews here that are needed.
Okay, and so the actual question was, how are you doing with staffing in terms of firefighters and volunteers? Does that mean so you guys are keeping people on the line that you need, but then releasing those that you can?
Absolutely. And that's standard operating procedure. Every time there's an incident like this, it's a balancing act to try to get enough resources, but to try not to order too much, because you don't want to bring everybody here and then have something else happen in a different county, and then they don't have enough to cover their own situation. So it's something that's constantly fluid. But the good news is, because of the situation with the fire right now, we are able to release some people, which just shows that things are improving. But of course, we need to keep enough people here to be able to do the job.
I have a question for you. I don't know if you can answer this or not, but are backyard burns currently allowed in California if people get the proper permits?
That is something that is a very complicated question, because it depends where they live, if it's in the SRA, what fire district they're in, what the particular laws of the county. So that's not something that I can just give a blanket statement to. And unfortunately, this is not my unit. I'm in Santa Cruz, San Mateo. So if you want that information, I can definitely put you in touch with the right person. But I can tell you a simple answer. If you have questions about the rules at your home, the fire station that is closest to you should be able to answer that question.
Any other questions for Cecile while we have her here? While we're waiting, I have a question for you. For the firefighters that you were able to call up to this fire, were they taken by surprise that it was about an unusual January fire?
I think everyone is not necessarily taken by surprise at this point, because we've been seeing this coming now for a few years. These fires have gotten a lot bigger, and fire season is extending longer and longer. But yes, it is unusual. In fact, I just got some new numbers from Weather Service this morning. Actually, I think we had, well, I don't want to give you the wrong information, but something to the effect of 12 to 16 inches of rain in the last few months. And then here we are with a fire of this magnitude at 700 acres. So the fact that we just had a lot of good rain recently, and we're still having a fire of this size and magnitude, just shows how dry the vegetation is right now. So that everybody should just understand that we may be getting this fire wrapped up, but there is every possibility that we will have more fires out of the traditional wildfire season. So just be prepared for what's next.
Preparedness is the word.
Absolutely. And thank you so much for allowing us this platform to be able to communicate with people. This is very helpful.
And I do have another question for you. Actually, a couple more coming in. Did whoever, again, this goes to the cause question, so I'm not sure what you can say. Did whoever was doing the pile burn know there were gusty winds expected in the area the day the fire was sparked? Was there a notice sent out about concerns from CAL FIRE in terms of weather? If it's not CAL FIRE's job to provide notice, who would it be?
So again, that's unfortunately something that I can't answer, because this investigation is ongoing, and we would never want to put the investigation at risk.
Okay. Any other questions for Cecile before we let her go? If any questions do come in, I will forward them to you for a response. Thanks very much for being able to drop in, especially on such a crazy day.
Absolutely. And thank you, Maya, for all your help. I appreciate you.
All right. See you soon.
Okay.
All right, so we're going from fires and we're going to go back to COVID. We're very pleased to have Kim Stemler here from the Monterey County Collaborative, talking a little bit about rapid tests. We all know rapid tests are still a little hard to get. We know we can order them from covidtesting.gov, but there are plans in the works to do more to try to get COVID tests in the community. Kim, you can talk a little bit more about that, I hope, especially now that the Board of Supervisors yesterday approved up to $1 million to spend on tests for the community. Hi, Kim.
Hi, Maya. Hi, everyone. Thank you so much. And thank you to the supervisors for doing that. Not only do we desperately need these tests in our community, but it also makes our purchasing power greatly increased to add $1 million to that. So currently, it is a really big challenge to obtain rapid antigen test, which is if somebody wants to go to work or to school the next day, they need a pretty quick response. So that's where the antigen tests come in. And that's really caused testing clinics to actually close because we don't have the supply. The Lightspeed clinics, although they're beginning to open slowly, they are closed today. So one, we want to just urge the public to be patient. We know lines at existing clinics can be really long. Please know the testers are doing the best they can with what they have, and we'll all get through this. So what we've done to help better position Monterey County to acquire the more tests is that the Monterey County COVID Collaborative put out the word and said, if you have the money or think you have the money to buy tests, let us know and we'll come together and we'll use our power, our purchasing power to get out on the market and see what we can do. We had over 20 entities, that does not include our partner, the county, come together, and that included schools and cities and medical clinics and nonprofit organizations and faith-based entities. You know, these are places that can't get tests, medical clinics that can't get tests on their own. So hopefully with this partnership with the county, we'll be able to attract a lot of tests. And next week, we'll tell you how many we were able to purchase.
It's great to be able to shop, right?
It's so nice to have money to shop. Yes.
That's really good news. And I think for people who are waiting and concerned about, you know, what's around the corner for testing, I think it's really good to know that that people, maybe they can't get a test today when they need it, but they know that help is coming.
Yes, and you also brought up, also everyone in this community should have applied or should be applying to the federal government to get those free tests. So 4 tests for every household. And Maya, you can repeat it better than I can.
I'm going to say, and of course I gave the wrong website initially, but it's covidtesting.gov. And not only you can order online, but I guess end of last week, there was a phone number that went up. So people who are not internet savvy, that maybe just have difficulty doing ordering online, can call a phone number and get the assistance for ordering. And they also have help in English, Spanish, and 150 other languages. So there's resources there for whomever needs a test. So I don't have any questions for you. I think you covered it all, Kim. Anything else before you go?
Let's just remind everybody about MontereyCountyVaccines.com. So that's the place where everyone can get testing. And as Dr. Moreno always says, and vaccine information, vaccines are still really important. So MontereyCountyVaccines.com, and I'll put that in the chat as well.
Yes, and it's covidtest.gov instead of covidtesting.gov. So please don't order a test from the wrong website.
Thanks, Maya.
Thank you, Kim, and we'll look forward to hearing from you about what was in your shopping cart next week. All right, and we're still going to stay on the topic of COVID, but we're going to move to the COVID-19 Collaborative, which is with the Community Foundation for Monterey County. And Dan Baldwin is here to share how the Collaborative is currently doing supportive work on this effort, and then to talk about some special awards that went out this week. Good afternoon, Dan.
Good afternoon, Maya. Thank you so much for allowing me a couple of minutes here. We formed the collaborative about 14 months ago in early December of 2020. And we created quite a lot of infrastructure. The Community Foundation made quite an investment. There were about 80 participants in this collaborative, and it's real multi-sector. It's public entities like the county and the county health department, healthcare, education, nonprofits, hospitality, small businesses, agriculture. So it was a place to have a table where everybody could come together and cooperatively problem solve. We thought that we were maybe nearing a time where we could sunset this initiative. We were talking about it in early December, and then we all know what has happened since then. So the value really began to reemerge, where you already had this table where people could come together. We met, in fact, it was just a week ago today, we had a meeting, and it was very robust. It was very helpful. And so the work continues. Within that, the COVID Collaborative, we've been partnering with the county. The collaborative has been, the chief sort of administrator for the Vita project, which is the community health worker program that was funded initially through $4.95 million from the county supervisors, which voted that in December of 2020, and is now being supported by a Health and Human Services grant once the county funding expires at the end of this March. There have been a lot of people from all walks of life that have come together to help make this program, Vita program, successful. And so we decided to create a Vita Champions Award. And thank you, Maya. And I think you're going to click to the next slide and just show all of those that recently received the award. It includes all of our county supervisors who had the courage to make the vote. You'll also see Raymond Costa, who owns McDonald's restaurants, who allowed community health workers, Vita agencies to set up and do testing and vaccination on his properties. It includes Ida Lopez Chan of the Soledad Community Healthcare District, Janine Chikarat, Managing Director of the Portola. I'm randomly pointing out some just to show the diversity of organizations that came together, because this is frankly the only way we could get this done. Right now we have about an 81% vaccination rate among county residents of over 5 years of age. We are a state leader, and I think that a lot of this is due to the fact that we were able to create this collaborative, and everybody just joined hands, joined in, and it made it a countywide effort to make this, do our best to combat the pandemic and make this the safest possible county that we could, set of communities to live in. So I will answer any questions if there are any, but I just wanted to share some good news. One thing I wanted to mention is that from January 1 to January 17, Vita community health workers conducted 18,900 rapid tests. That is a remarkable statistic. Over 2,100 were tested positive. Well, I take that back. That's in January alone, it was 7,659 tests, but overall, it's been almost 19,000 tests. It's just been a tremendous effort, and they have the ability on the spot to help quarantine. They are equipped with tablets to be able to help people navigate the system and make appointments. It's just been, and that's been funded through a third party funder. David and Lucille Packard Foundation have also helped underwrite a lot of the expenses for the collaborative and for really providing the back office support for Vita. So I'll stop there. Maya, thank you so much for the opportunity. And if there's any questions, happy to answer any.
Thank you. If there's any questions, please go ahead and put them in the chat for Dan. I think Vita is quietly working kind of like an undercurrent in the community. There are a lot of people who maybe work a regular 9-to-5 job, don't know that there are others who may have more difficulty accessing testing or vaccines or all that would be needed if they were impacted by COVID. And Vita has really swept in and assisted a community that, that they could get them in a way nobody else could. They could get to them in a way nobody else could.
And I think the premise there is that it's neighbor helping neighbor. I mean, these are trusted advocates out there providing information and services. So if you live in one of these communities and it is someone that you've known and trusted for years who's delivering this information, it goes a long way to getting greater community participation.
Thanks very much for sharing the success of Vita as well as the awards, because I think it takes a village to make it through. And I think people don't realize how many people have been involved in making this a success.
It's been quite an undertaking. I want to acknowledge Michael Castro of the Community Foundation, and Kim Stemler, who helped us so much with our vaccine and testing efforts. So thank you, Maya. Thank you so much.
Thank you. So we're going to turn away from COVID for our last topic and a little bit back to what we recently went through with the fires. We're going to talk about resiliency. And Monterey County, as you may know, has been working on a resiliency plan. And boy, we understand resiliency because we've just been through a fire and people in that area are going to have to be resilient again. And Luna Muhammad from the Office of Emergency Services is going to talk about the status of the plan and about some interesting opportunities for people to ask the experts about how to be resilient and how to be prepared. Hi, Luna.
Hey, Maya, how are you?
Good, and you?
I'm doing great. So like Maya was saying, the Monterey County Community Resilience Plan, which has been in the making for like 3 years now almost, is going to the Board of Supervisors for review and hopefully approval on Tuesday, February 1st. That same day, we are going to be having our first OES office hours. So I'm going to share my screen real quick. Can everyone see that? Good. Okay, cool. So the Office of Emergency Services helps with emergency preparedness, mitigation, prevention, response, and recovery. We also activate the Emergency Operations Center for fires, for COVID, and for all types of emergencies. We wanted to make an opportunity that allows the community to have some extra time aside from regular business hours to speak with OES staff, to ask questions, and to learn more about our office and disaster management in general, or whichever portion of disaster management they're interested in learning about: preparedness, response, recovery, mitigation. This will be starting, like I said, February 1st. That's Tuesday. It will be every other Tuesday from 6 to 7 p.m. Eventually, hopefully, we're hoping to have some in-person in the community times where we can hop between different communities in the county and allow some face-to-face discussions. But for now, we will be having it on Zoom. The Zoom link, I will be sending that right now when I finish speaking on the chat. It's also available on our Resilience webpage. So I just pushed it into the chat. It's available on our social media and our Resilience webpage. On that Resilience webpage, you can also find information about preparing for potential upcoming wildfires. You can find the exact dates. So since it's every other Tuesday, that might get a little confusing for some people. There's a calendar there along with the link I just sent. So that's that website. I just pushed it in. So it's just co.monterey.ca.us/resilience. And we have everything from preparedness material on there to information about the community resilience plan. And hopefully once it's approved, we'll have that final draft published there as well. That's in English and Spanish. We're trying to make everything related to this community resilience plan and its initiatives, including the Oes Office Hours, bilingual. So the plan is available in English and Spanish. Office hours will be available in English and Spanish as well. We invite anyone in the community to come to talk to us about a specific disaster or just disasters in general. And yeah, take any questions you have. Thank you so much.
Thank you. And it's really exciting to see this 3 years of work being finalized next week and approved at the board level. But let me ask you, in case we've got some other questions coming in, what are some of the common questions that people have about disasters? Because you say the word resilience and people don't always equate being resilient with making it through a disaster.
Absolutely. So some of the common questions are generally about preparedness. A lot of it's on where to get information. Something that I have noticed and just the past few years of all the disasters we've experienced in this county is when it happens, people are like, where do we get the information? If you have that ready beforehand, and we have that all on, and we have a disaster resource directory on that resilience webpage as part of that plan as well. If we know where to get the information, who to call, what social media or website link to go to, that information is a sense of comfort, and it's something that I constantly get asked about. One great place to get information and to know if you need to evacuate or what's going on to protect yourself from a disaster is Alert Monterey County. And I'll add that link in the webpage as well. It's alertmontereycounty.org. That's a huge answer to a lot of the questions about needing information during a disaster, because we'll send out the emergency information there along with a link that will direct you to more information. Another great resource, 2-in-1, as far as information goes. As far as preparing, another question I often get is about preparing when you don't have a lot of money or a lot of time to dedicate to the preparation. We'll tell you to modify your house for earthquakes and have 100 feet of defensible space for wildfires if you live in an area that's around a lot of forests, but that is time consuming and it can cost money. Things that you can do today to protect yourself from a disaster: have your shoes next to your bed, have a flashlight next to your bed as well, keep your phone charged. Little things like that, they make a huge difference when something happens, and they're free and they take a couple minutes to do. But definitely take yourself a little bit of time. Another free thing you can do is reading our Resilient Toolkits, which resilience is that ability to not just withstand disaster, but to come back a little better from it, from learning from that experience and growing from it, becoming a survivor and not a victim of disaster. So that's that kind of term of resilience and how it intertwines with preparedness. I do recommend everyone go on that website and read a little bit about our toolkits and the resources and information available to help you prepare. It doesn't take too much time. It won't cost you $1 to do it, and it could save your life. So.
And signing up for Alert Monterey County is one easy way. So you know that if there's a disaster, you will get the call that you need. All right. I have no questions for you. Thanks very much for kind of running down where the resiliency plan is now. And we look forward to office hours soon, and hopefully you get a lot of questions.
Hopefully. Thank you so much, Maya.
Thank you. And thanks everyone for joining us on the briefing today. Our next briefing is next week. We'll see you then.